Thousands of Oklahomans have seen their extra pandemic-era health benefits eliminated since the new year began, and now many more are dealing with another dilemma: scammers. Joe Filomeno joins us now with the details. Joel.
Rich, public health officials and law enforcement aim to educate the public on what they should expect from scam callers and what steps they need to take.
There's a reason that we're getting so many of these calls. It's because they work.
Oklahoma County Sheriff's Public Information Officer Aaron Brobeck says it's getting harder to figure out when a scammer is calling.
They know the area, they know the geographic layout of the area. Oftentimes they know the names of some of our deputies, they know the names of some of our judges, they know where the courthouse is. They're so sophisticated, in fact, that they'll say, hey, I want you to call me back at this number. And when you call, there's a machine that picks up and says, you've reached the Oklahoma County Sheriff's Office.
Oklahomans receiving scam calls include Sooner Care members.
We've had some calls from our members where someone has called and said you owe some money before you're disenrolled and you need to write a check and provide this information, or provide personal health information.
Sooner Care is Oklahoma's version of Medicaid, providing access to health care for Oklahomans with lower incomes. The Oklahoma Health Care Authority runs Sooner Care, and its CEO, Kevin Corbett, says that members should call the agency if a scammer contacts them seeking personal information.
That's not what we will do. And if you get a call and someone is asking for personal information, whether it's social security number or anything like that, the best thing to do is to hang up and call back to us. We certainly don't want anyone to feel threatened or vulnerable and taken advantage of for whatever reason it might be, whether it's trying to get their personal information to scam them out of that information or to scam them out of some payment, if you will. So we're trying to avoid that at all costs.
It's really important for people that are in this process to be proactive, to take action.
Health Alliance for the Uninsured Executive Director Janine Yanis Jones says scammers typically try to trick unsuspecting victims to give them money.
Please do not give payment information over the phone, especially if you're trying to enroll in a free program or get re-enrolled in a free program or with a free clinic.
As far as holding the phone scammers accountable, that's a little more difficult.
They're using burner phones. We don't know if they're in the country, we don't know if they're out of the country, we don't know if they're in the state, we don't know if they're out of the state. Trying to track them down is virtually impossible.
He says that scammers have even incorporated AI.
So what they'll do is they'll troll some of your social media sites. They'll find out who your grandchild is and get a sample of the grandchild's voice, and using artificial intelligence, put together a phone message that sounds just like your grandkid.
Brobeck offers this tip to avoid the deception.
What we suggest for something like that is, within your family, have a code word. A code word that only you and your family know.
Corbett advises one way for Sooner Care members to avoid some scams is to simply keep their information up to date.
If anyone receives any communication from us saying we need some information from you to validate and continue your coverage, please respond. We need to make sure we have the most current information available.
Keeping your information current is especially important now that the public health emergency declared during the pandemic is no longer in effect.
Dial back about 3 years ago when the pandemic occurred, obviously a public health emergency was declared, and from that we had the opportunity to do many things in the Medicaid program. One of the things that we were able to do is provide continuous coverage.
A reason why scammers are going after Sooner Care members is because the Healthcare Authority began the post-pandemic disenrollment process in late April and continues until the end of the year.
We did it over 9 months. It's about 30,000 individuals a month. We started that May 1. We'll have another group that becomes ineligible and be disenrolled starting in June, if you will, and do that for the next 9 months.
Corbett says that the agency carefully planned the disenrollment of Sooner Care members.
As it relates to the public health emergency, we want to make sure that everybody is treated in the most compassionate way. So if there's information we need to make able to continue their coverage, get that to us. The most vulnerable people will not be disenrolled until the end of the program.
About 500,000 people are currently uninsured in Oklahoma, but the disenrollment process will increase that number dramatically.
That brings us to almost, with about 545,000 uninsured, an additional 100,000 approximately of people who also don't have access to health care, plus the 308,000. It brings our state to almost 1 million uninsured by the end of the year.
Jones says that the uninsured do have other avenues to access affordable medical services.
There's 92 free and charitable clinics in the state of Oklahoma, and the free clinics are a vital part of the healthcare safety net.
Scam callers are targeting uninsured Oklahomans as well.
It's devastating for the individual, but it's also devastating for our state because now we have people that are maybe in a health crisis.
Again, the best advice is to be cautious and skeptical if you receive a phone call from anyone offering unsolicited healthcare advice or seeking personal information.
What I tell to members is be vigilant when it comes to those trying to take advantage of you. Be suspicious. Again, hang up, call back, verify that you're talking to a valid person.
If not, your next phone call may be to the police to report you've been scammed.
You can call your local police department, but again, understand that the chances of us solving the case are generally pretty slim. The best way to combat this, the best way to cut this thing off is by being aware of it going into it.
OHCA encourages members who receive scam calls to contact the department helpline at 800-987-7767 for additional help and information.